This next module will talk specifically about cultural adaptations to pearls. Specifically, we'll cover how depression and depression care is cultural, the process for making cultural adaptations, the cultural adaptations framework, and the pearls model and some example of cultural adaptations. So first, both depression and care for depression is cultural. One's cultural background influences cultural meanings and norms about depression and depression care. So here we use Huang and colleagues' model for understanding culture's impact on mental health. First, expression includes whether someone presents with emotional distress and/or physical symptoms for their depression. What words do they use to talk about their depression? Looking at assessment and diagnosis of depression, it's important to consider whether there's any stigma about depression and whether a person is expressing universal depression symptoms as measured in the PHQ-9 or cultural idioms of distress. Looking at coping styles and help seeking, it's important to see whether somebody prefers receiving care from their faith community, from primary care, or specialty mental health care. This can be important as you think about who to train to do outreach and engagement for pearls or to deliver pearls itself. And lastly, treatment is cultural. What are appropriate and accessible depression treatments for the older adults that you are working with? Pearls cultural adaptations come from our community engaged research and practice since the model was developed in the early 2000s. So how were these adaptations made? In terms of our practice, we have nurtured a Pearls community of practice since 2010, where we've been providing monthly technical assistance calls where Pearls providers discuss how they've culturally adapted the model for diverse populations and settings and share stories from the field. We've also provided one-on-one coaching and technical assistance and networking where we try and connect organizations serving similar populations across the country. In terms of some of our research studies, we've looked at lessons learned from providers and participants in adapting the model using REAIM in the Translating Pearls article. We did a research study looking at recruitment and retention of the program with traditionally hard to reach or underserved populations called It Could Be a Pearl to You. And recently we completed an evaluation looking at how pearls might increase social connectedness and specifically sampled organizations that reach underserved communities, such as communities of color and communities experiencing poverty. The cultural adaptation framework provides one model for thinking about how to make cultural adaptations to an evidence-based program. This is a model developed by Barrera and Castro, and you can see the reference here at the bottom of the screen. So first, it's important to partner with community organizations to specify when and how to do adaptations. This includes both selective adaptations, which are designed to meet the needs of that community that you're working with, as well as directive adaptations, which are driven by data, such as gaps in services or particular needs or strengths from the community that you're adapting for. Next, it's important to make adaptations to improve the social validity of the program, so such as the acceptability or satisfaction with pearls, or making pearls a better fit for different organizations and the populations they serve. Adaptations can also be made to improve engagement in the model. Given the stigma around depression and depression care, this is really important, how you talk about and market and describe pearls to potential participants. And adaptations can also be made to improve depression outcomes in and of themselves. What outcomes are you targeting for depression, as well as what are some of those mechanisms or mediators on the pathway to improving depression, such as addressing social needs, improving quality of life, and other things of importance to the populations you're serving. As such, we have adapted both pearls itself as well as the different ways that Pearls is delivered, as we talked about in the last section. In terms of thinking about the Pearls model and cultural adaptations, there's several ways that Pearls can facilitate making cultural adaptations. First, the model is person-centered. So Pearls is really designed to focus on what matters to each participant and align with their cultural beliefs and norms, not just about their depression, but about how they want to approach their care. Pearls is also designed to be delivered by organizations that reach diverse cultural communities who've traditionally been underserved by depression care for older adults. So this is advantageous for making cultural adaptations because these organizations often have strong trust and rapport with their community, bring cultural humility to the work in order to not stereotype or make generalizations about older adults from different cultures. They're aware of adding care components that can address some of the minority status stressors that impact depression outcomes, such as racism and sexism, as well as equal access to care. And lastly, these organizations can really address some of that stigma around depression and depression care by training up trusted providers in settings where older adults are already comfortable socializing or receiving meals, practicing their faith, or other important cultural beliefs and norms. So what are some of the ways we've adapted Pearls culturally? One are cultural and linguistic adaptations to really align with cultural beliefs and norms and values and to address stigma around depression and depression care. So this is modifying outreach and program materials, as well as what words we use for depression and other supports for the program. We've also trained staff from the community to provide both outreach as well as delivery and other supports for the model. And we've partnered with trusted organizations for engagement, whether faith-based organizations, organizations delivering meals, providing healthcare, or other supports. Some of the ways we try to talk about depression in a more culturally appropriate way is clarify that it's not a normal part of aging and that it is normal to feel depressed due to poverty, racism, and other social determinants. So how do you help someone understand that what they're feeling is something called depression and something that we can do something about with the Pearls model? Also, we want to destigmatize that having depression is not being crazy or that something's wrong with you, but that is something that's treatable and that can happen as we age.